to other databases. Medline is the indexing of almost all the medical journals. So it tells you here, while you're searching journals /Medline, that you might have access to this journal, not through MD Consult, through another database. So it will give you a cross-ref. For example, look here, when you have the PDF and full text, that means it's from MD Consult. When you have abstract only, that means you don't have access to it, it's only abstract. But in the case where you have the icon cross-ref, that means you have access to this article, but through another database that you have access to. So MD Consult can recognize that you have access to other databases and it helps you search within them. So you click on cross-ref and it goes to that database where you have access to it. Yes, for example, it took you immediately to Science Direct. That means this article is not through MD Consult, through Science Direct. And you can, for example, here download it in PDF. Of course, some of the databases, as Dr. Ahmed explained, they might require a username and password. So, here, let's see how it looks like. This is. So this is the article, for example, it opened in PDF through Science Direct. Let's go back and here. I can't see. Okay. So you can see that this is a preview of the article. And this is how it looks like. It can give you an idea about, yes, it can give you an idea about the article. Or you can click on the abstract to read the whole abstract. So again, when you view the results, if you have the full text and PDF, that means you have access to it through MD Consult. If you have only the abstract, that means you can see only the abstract. If you see cross-ref, that means you have access to it through another database that you subscribe to. So that's the purpose of searching also Medline. If you want to see only, of course, you view them according to relevance, newest to oldest, and full text only. You click full text only, you see the content from MD Consult. And of course, for all the journals, you have access to the issues of 4 years back. So, for example, SDL, they subscribed in 2010, I guess, 2010, 11. So you have access from 2006 till this moment of issues. The clinics review articles, they are the clinics of North America. For their importance, they put them in a separate tab. Of course, here there is no midline. You're only searching full text for these articles. The patient education section, as I said, they are handouts that are given to patients to explain to them a condition they have or a drug they are taking. So you can view these handouts according to conditions and treatments, medications, according to specialties, or Spanish. Spanish, it's again an American product, and Spanish is the second language, so we have them in Spanish. In Elsevier Middle East office, we translated the Ferries Netter patient education handouts into Arabic, again in a very simple language. We finished 600 of them, and we shall be putting them very soon on MD Consult. You can search for any keyword, even for the patient education handouts. For example, back pain, a very simple term to search for me. For example, back pain in pregnancy, just to give you an idea how they look like. It gives you an overview of the condition, the causes, symptoms, diagnosis, treatment, seek medical care if, basic information for the patient. Here in this section it shows, if I'm logged in, for example, in my own username and password, it will show me it will show my name and my contact details, and you can add in a box follow-up notes or some specific instructions for that patient. In the drugs section, it's the gold standard drug database where you can search for any drug by the generic name or by the brand name. Any drug to search for? Something easy, huh? Huh? Spell it for me. Again? M. Okay. Is that a generic name? اسم علمي ولا scientific name? Okay. Okay, it's a scientific name and it shows you here the some of the brand names for it. Okay. You click on that medicine or drug. But before, okay, we have assessment forms for the training. They are with Ms. Mashal. Bashayr, sorry. Okay. This is internet connection problem. Okay. So for each drug, you will have the patient education for that drug, indications, dosages, administration, contraindications, interactions, adverse reactions, monitoring parameters, chemical structure, and you have photos of that drug and the forms that they can come in. And you can see here how the drug can come, in what forms.